Back to Martino TV. I'm Tom Martino. Given our climate, we're all prone to having dry skin, chapped lips, and dry eyes. In 2006, the National Women's Health Resource Center named the top 100 dry eye cities. Guess what? Based on temperature, humidity, wind, altitude, pollutants, and allergens, Denver was number 17 out of the top 20 as eye hotspots. All right, we're going to talk to Dr. John Dishler. He is our weekly expert on eyes and, of course, a pioneer of LASIK surgery. He's done 50,000 of them. He has his own surgical center, a real surgical center for day surgery for LASIK. But today we want to talk about dry eyes, and there's a reason. There are some people that will have you believe you need LASIK surgery or you need glasses when you don't need either of them. Why? Because of dry eyes. You mentioned that, and you know what? When I started moistening my eyes, I could see better.
Yeah, isn't it amazing?
Yes.
Most people don't realize it, but what we see through is not the front of the eye, the cornea, but we actually see through our tear film. And the tear film is this liquid layer on the front of the eyes that's just so important for good vision.
Now, we always get calls for you, and I want to, and most of the time after you've left, so we need to tell you, if you have a question for Dr. Dishler, 303-MARTINO, right now, we'll get you right through, or live at martino.tv. So, if you talk about the eye and where you see through, can you show us on here where the tear film occurs?
Sure. So here's the eyeball, and the tear film is what coats the front of the eye.
And what does it look like when it's healthy?
And the tear film is really, you know, kind of like our blood, and this is the thing people don't realize.
Does it have nutrients? Are we talking about nutrients?
It has tons of stuff. Now, it's very important to realize, of course, the tears are mostly water, so being well hydrated, drinking a lot of water, not getting dehydrated. Tear film. This is the front of the eye, and this is the tear film, and it looks almost like a fish tank with a lot of fish swimming in here. But what I wanted people to realize, I don't want this to be a dry lecture on dry eye, but there's tons of stuff. There's all kinds of things in the tear film that need to be healthy, and we're learning more and more about this all the time. Proteins, all kinds of cytokines, they're called, mucin. Of course, one thing that's important is the phospholipid layer, which eating salmon, fish is good. Omega vitamins is good for people that are deficient in that. But the big thing that we're learning is that you need to have enough tears. And so artificial tears that come in a bottle are good, but they don't really replace the real tears. So one of the things that we're doing with a lot of people is using punctal plugs, which plug the drainage of the tears.
When you hear that, it sounds kind of brutal.
Non-surgical, 10-second insertion, totally painless, totally safe. We have ones that can dissolve as a test.
So these plugs here, if you talk about plugs, go actually into
the eyelid, onto the edge of the eyelid.
And it causes a backup of fluid, so to speak?
Right. It's sort of like a sink with the tears are kind of a dam, and it keeps the tears in the eye. So that's our first line of defense. Is hydration, and then after that, artificial tears, then punctal plugs. And there's a whole new group of eye drops that are called things like Restasis, which help. And here, see, I can show you, this is the sick tear film here, the dry eye tear film, which is really a sick tear film.
Is it sick because it's not enough moisture or not enough nutrients?
It's not enough moisture, it's not enough nutrients, but it also has a lot of these inflammatory products. These cytokines are increased. So what we have learned, and this is the big thing, a lot of dry eye is caused, especially in women, and especially in middle-aged women, by inflammation. It's an inflammatory disease. It's kind of like arthritis.
Can you take anything to get rid of that?
Yes, these new drops that are out will reduce the inflammation and restore the tear film to a healthy state.
So we can actually see better.
We can see better. And the important thing is that patients are evaluated before LASIK for dry eye.
Yes.
That we don't treat them with LASIK or PRK or anything like that until we know that their tear film is healthy. And then after LASIK, if their tear film becomes sick at all, that it's monitored by an expert who can then step in and do the appropriate treatment. And this makes a great majority of patients, 20 happy after LASIK, because there's some worry that people after LASIK, like you had talked about, their eyes feel dry, they don't see quite as well.
Or they're getting older and they get dry. And have you had people come in, and by the way, we do have a phone call, have you had people come in who thought they needed glasses or thought they needed LASIK, and you just said, hey, you have dry eyes.
Absolutely.
That's wonderful to find out.
It is.
I found it out because of you. I started, as soon as I moistened my eyes, I said, wait a minute, he's right. I thought maybe I needed an enhancement or something on my LASIK.
Right.
Who do we have on the phone? We have someone on the phone? Shelly, hi, I'm Tom Martino. Welcome. What is your question?
Good morning. I don't have a question. I just wanted to say that I had LASIK surgery with Dr. Dishler.
Oh, you did?
Not quite 3 weeks ago.
Okay, Shelly, 3 weeks ago.
Oh, okay. Hi, Shelly.
Hi, how are you?
What was your experience like?
It's been great. The worst problem that I've had, like he's talking about, is dry eye. And the worst problem that I have is in the morning when I get up, my eyelids are stuck to my eyeballs until I put drops in them in the morning.
Does LASIK make an eye drier than normal?
Yes, temporarily it does because the little nerve endings are cut, and so the eye doesn't have the right stuff to make enough tears. But after about 3 months, usually those all heal back, and the dry eye problem usually goes away. It takes about 3 months.
So you recommend good lubrication in the eye after LASIK?
That's right. That's right. And he needs to be sure to drink water before he goes to bed, use drops in the morning, and if having problems, needs to come in and have some of these punctal plugs put in.
Are they permanent?
Well, there's temporary ones, which is probably all he needs, and there's permanent ones that will last pretty much indefinitely, and that also helps a lot. We see a lot of people that wear contacts that say, hey, I think I have to have LASIK because I can't wear my contacts anymore. Sometimes just treating the dry eye, if the patient wants to, that lets them continue in their contact lenses. Can
we talk about prescriptions that you offer for patients before surgery, after surgery? Because what they have to understand is you're a full service eye surgeon. You are a surgeon. You are a medical doctor. Can you explain some of the things you do for your patients?
Well, we evaluate every patient and we give them whatever treatment they need, whether they need surgery or not, of course. We want all of our patients to see as well as possible. For patients that have surgery, of course, we include all of their prescription drops that they need.
All for the same price?
All for the same price. There is one exception. There's one drop that we have to give them a prescription for, but everything else is included. We also put punctal plugs, temporary punctal plugs, for free, which usually cost hundreds of dollars.
As part of it, in every patient?
Because Denver's so dry, we found that by preventative medicine, by putting these punctal plugs in that last for about 3 weeks, we get most people over that hump. Shelly, when he called, his may be dissolving now and he may need a second set.
What I'd like to know is this automatic with other clinics? Do they all include these plugs?
As far as I know, they don't. They only put them in as they feel is necessary, and they usually charge for them. We just have found that putting them, there's never been a side effect, there's never been a downside. And we just include them at no charge for all of our patients as just an extra sort of premium thing to make the whole experience just a little smoother.
And I had an instant message here that wanted to know about, can you get hooked on eye drops like you can with nose sprays where you need them because you use them?
Yes. The answer basically is no. Now, eye drops
you can't?
You can't. Now, eye drops that get the red out, like Visine, you can get hooked on those.
Really?
Because they constrict the blood vessels, and then when they wear off, people's eyes will get redder.
Oh, so you can actually overuse those. You can
overuse those, the ones that get the red out. But the artificial tears, the ones that are just moisture drops, you can use those and you won't get hooked on those.
That's good to know.